I'm Dr. Ryan DeBell from The Movement Fix. This is Movement Fix Monday, and I want to show you guys this week a self-mobilization to the ankle to improve your dorsiflexion. Now, a couple weeks ago, I was up in Canada outside of Toronto, and there's an osteopathic student, a guy about to finish up osteopathic school in Canada, and we were talking about ankle mobilizations, and he showed me a really interesting self-mobilization. His name's Nate, and we talked about me sharing it in this video, so thank you, Nate. And let me show you guys kind of what we're dealing with here. So what I'm gonna do for this ankle mobilization to improve my ankle dorsiflexion, which is required for squatting and those types of things, is I'm going to sit onto a box or something like that, and I'm gonna put my leg that I'm gonna work on up like this. And what I'm gonna do is I'm gonna find the little bony prominences here on the foot. So both this one here and then the one right here. And I'm gonna take my hands and I'm gonna go just on this side of that bony prominence. And I'm going to grab like this. Now what I'm gonna do here is I'm going to pull with the muscles of this leg. I'm gonna pull my leg this way as I pull with my hands this way to work on sort of distracting some of the joints of the ankle. Now, once I have that pressure where I'm separating, I'm going to actively take my ankle through this range of motion from dorsiflexion to plantar flexion to dorsiflexion and plantar flexion. But what I'm primarily trying to accomplish here is pulling this way and this way. So what it would look like is I'm going to grab here like this, and I'm going to pull with my hands, and I'm going to pull, you can't see it obviously, but I'm pulling with my leg, and I'm actually kind of using this leg down here to assist in this pulling motion, and I'm going to get some tension there, and then I'm going to go back and forth just like this. Now I'm not pushing as hard as humanly possible, but I'm putting a fair amount of pressure through here, and I'm going to go 10 reps back and forth, back and forth. You can hear some crunching. You can hear some clicking sometimes when you do this. And I'm just gonna go nice 10 reps. After that, I'm gonna wiggle the ankle around just to kind of let things settle. And then I would do the other side. Now this is a great way to mobilize the ankle. And actually, if you do it right away, you'll probably feel a substantial change in your ankle dorsiflexion range of motion. But the thing is, if you just do this ankle mobilization and then you don't do something else afterwards, it will likely go back to the way it was, maybe 10 minutes or 30 minutes later, and then you have to do it again every day. So what we can do instead, after you do the ankle mobilization, once the joint is loosened up, however that's happening, whether it's the joint moving more, neurologic, etc., what I can do is I can go into a plank position. So I'm going to get down into a push-up plank, and what I'm going to do at the bottom of the plank, when I'm in the plank, is I'm going to use my shin muscles right here to actively pull my ankles like this as far as I can. So I'm going to go here, I'm going to rock forward like this, and then I'm going to rock back, but I'm not using my hands to do this. I am pulling with my ankles. I'm pulling my ankles into dorsiflexion and then coming out of it. And then I'm going to do another rep where I'm going to pull, feeling it in the front of the shins because those are the things working here. And then I'll go again, pull. So that's a way to then use some of the musculature in the lower leg to create ankle dorsiflexion and own the range that you just improved by doing that ankle mobilization that I showed you. And then I want to integrate it into a squatting pattern. So I'll grab a kettlebell and I'll do a goblet squat. I'll just descend down, come back up. Maybe I'll do a few reps of that so that I then take that ankle range of motion that I got in that ankle mobilization, used it and sort of taught my brain how to actively control it in the plank, and then I integrate it into the goblet squat so that way my brain understands the ankle range of motion and I don't just do the ankle mobilization and then have to do it again and again and again without it ever integrating actually into the squat. So that's what I got for you guys for this week on Movement Fix Monday. Hey, if you don't already like the Facebook page, make sure to check it out at facebook.com/The Movement Fix, and you can follow me on Instagram at The Movement Fix. I'll see you guys next week.